Symptoms of a blood clot in the legs. Many women suffer from varicose veins in the legs, a condition that is not only unsightly, but also dangerous. We should never ignore the condition of the varicose veins. Whether large or small, it's important to keep them under control and to periodically follow up with your doctor to avoid a possible venous thrombosis, otherwise known as a blood clot. As you already know, varicose veins form as a result of poor circulation, but sometimes the blood condenses, leading to a dangerous clot that completely obstructs proper blood flow. How can we prevent this condition? What symptoms are usually associated with venous thrombosis? Today on our site, we'd like to answer those questions for the sake of your health and peace of mind. What is a venous thrombosis? This simple term is often frightening: deep vein thrombosis or DVT. The cause of this problem is always a blood clot in one of the body's veins. It is usually deep and almost always located in areas where blood flow is the poorest, like the calves and thighs. The greatest risk is that the clot may dislodge and travel through the bloodstream to a pulmonary artery, cutting off circulation and causing what is known as a pulmonary embolism. This is a very serious risk that you need to be aware of. While it's true that this problem usually affects people between 50 and 60 years of age, but this is a problem that younger women should not ignore because your health depends on the condition of your varicose veins. Doctors tell us that clots or thromboses are more likely to dislodge if they're located in the upper part of the legs or thighs. Hence periodic checkups are extremely important, and if experts consider early intervention important, then we need to do it for our own safety. Symptoms of venous thrombosis in the legs. What symptoms should you be looking for if you suspect you have a blood clot in your leg? First, there are two types of venous thrombosis, superficial and deep, which carries a higher risk for complications. Take a look at the symptoms associated with each one. Superficial venous thrombosis. This type is easily recognizable. You'll notice that the vein is enlarged, resembling a cord. It will be hard, blue, and painful to the touch. It's easily visible and very painful. This area will often feel hot, accompanied with almost unbearable pressure, late in the day. We must be careful with this type of thrombosis because, in addition to being the first step to a more severe deep vein thrombosis, it's also subject to infection, or what is known as phlebitis. Deep vein thrombosis. Unfortunately, when a superficial thrombosis becomes deep, it's often not noticed. However, you should be aware of the following symptoms. A feeling of heavy pressure in areas with the most noticeable and swollen varicose veins. An almost unbearable sensation of warmth in the area. A tingling that goes up the leg to the groin. The leg feels hard and very rigid to the touch. Be very careful if the skin turns blue or becomes very pale. This means the arterial blood is having a difficult time reaching the leg. Can a venous thrombosis be prevented? Almost all varicose vein problems are genetic in origin. Hereditary factors combined with unhealthy lifestyle choices, like a poor diet or being overweight, will undoubtedly result in varicose veins. When you notice varicose veins beginning to appear, it's time to put all your efforts into avoiding a superficial vein thrombosis. Exercise daily. Getting out and walking for a half an hour a day, for example, will help a lot. Swimming or biking are two additional options. Take cold showers. Avoid salt in your diet, as well as sugar, fats, snacks, soft drinks, white refined flour and any foods that contribute to poor circulation. Drink plenty of fluids, including natural juices and herbal infusions of horsetail, pennyroyal, or rosemary. The buckeye is a plant that is used to treat varicose veins, and some very effective creams use it as the main ingredient. It can be found in pharmacies and is very effective in treating varicose veins. If your veins are very noticeable and have a blue color, consult your doctor about the possibility of an operation. Hanging overhead like the sword of Damocles, the risk of a clot is ever present and dangerous. Always follow your doctor's advice.